Good evening, Kathy. My name is I'm a practitioner student. So today I'm going to check your musculoskeletal system and also your neurology system. Are you okay with that?
Yeah.
Okay. So I will take a look at from the anterior side, posterior side. So looks like she's asymmetrical, bilaterally. There's no lordosis. There's no kyphosis. There's no sclerosis. Good. So bilateral symmetry in length, in the height, so in the alignment. Good. Take a look at your skin to see any discoloration, there's any mass. Check your muscle size. So like a bilateral symmetry. Yeah. So the muscle tone is firm. There's no atrophy. Active and passive range of motion. And I'm going to check the passive range of motion. Just use force. So the passive range of motion, it's about another 5 degrees. Hands, your wrist. Let me take a look at your hands to see. Okay. So there's some landmarks, like some crease on your palm, crease between your digits, palpates the joint to see any swollen. Do you have any pain?
No.
No pain, no swollen, no tenderness. So the same thing, check the other side. Like put your hands together. Okay, good. So it's symmetrical, and each side has 5 digits. That's complete. Could you spread your hands? Okay, good. And put them together. Okay, there's no deviation. Your hands and the wrist movement. So could you just bend your fingers? Good. Extend your fingers. Good. Bend your wrist. Okay. So push my hand. Push my hand bothly. Okay. Then extend your wrist. Good. So push my hand. Good. Could you use your thumb to touch each finger? Good. And also touch the base of your small finger. Good. The other hand, elbows. So let me take a look at your elbows. Some landmarks. So oculorenal process. This is medial echicondyle. This is a lateral echicondyle. So let me palpate them. So the joint is good. Do you have any pain from there?
No.
No. Any pain from here?
No.
There's no swelling, no nodules. There's no tenderness, no pain, no masses. Good. Could you just extend your elbow and flex it the maximum? Then keep it like 90 degrees. Turn your hand down and up. Good. Just push my hand. Okay. Then extend your hand like this. And push my hand too. Good. To check your shoulders, let me take a look at the contour and the shape of your shoulders. I can see it's bilateral, symmetrical. So this is a clavicle, and this is scapular. Just turn around. This is scapular. Acromial process. Great tubercle from the humerus. Palpate the muscle and the joint. The muscle. There's no tenderness, no pain, no swelling, no hardness. Palpate the biceps groove. Is there any pain from here?
No.
Any pain from here?
No.
Like shrug your shoulders. Good. So the rise at the same side, the same height, and simultaneously. Raise both of your arms like over your head. Good. Raise both your arms laterally over your head. Yeah. Okay. Extend and stretch your hand behind you. All right. You swing your arm in front of your body. Okay. Both hands. Place your arms before your hips and elbow outside. place both arms over your head to check your temporomandibular joints. Could you open and close your mouth? Do it again. Good. Is there any pain from here?
No.
Both sides? No? All right. There's no pain, no crepitus, no tenderness, no locking sound. Protrude your lower jaw. Right? Yeah. And retract your lower jaw, your chin. Good. And move your chin laterally. Open your mouth bigger. Clench your teeth like this. Feel the muscle strength, cervical spine. I'm observing the neck in anterior and also posterior side. The head in a neutral position, bilaterally symmetrical. I don't see any nodules. From the lateral side, I can see the neck spine in concave curvature. To palpate the neck, the spine process, and the paravertebral muscles to see any swollen, any nodules, any mass. Good. To check the motion of neck, could you bend your neck forward? Okay. And push my hand. Okay, that's good. And extend your neck. Good. And to the lateral side. Good. Okay. Push my hand. Good. And the other side. Good. The strength of the sternocleidomastoid and the trapezius muscles is also checked. I'm going to check your thoracic and lumbar vertebra. They are in the middle line. This is some landmark. This is C7 vertebral process. And this is the iliac crest. The iliac crest is the same height. The thoracic vertebra is in convex curvature. Lumbar vertebra in concave. Palpate. This is the process. This is the paravertebral muscles. There's no tenderness, no pain. There's no swelling, no masses. Palpate the process. Each vertebra. Do you feel any pain?
No.
No muscle spasm. There's no tenderness, no swelling. Good. Just bend forward. So take a look at the curvature. Try to bend back as possible as you can. Bend to each side as far as you can. Good. I'm going to stabilize your pelvis so you can swing your upper trunk. Now I'm going to check your hips. This is the iliac crest. This is a great truncular of the femur. Swing your leg backwards. Other legs. All right. Okay. Now could you raise your leg without a flexion of knees? Good. And the other legs. Could you swing your leg laterally and medially? Do it laterally. Okay. When you do this, I can raise this leg. Okay. Good. And the same thing the other leg. This is laterally. This is medially. Okay. To flex your knee and put your foot on your table. Then rotate your knee. Okay, next I'm going to check your legs and your knees. The anterior aspect, look at the knees, the posterior parts and the popliteal parts. Okay, good. Don't see any nodules. Okay, this is the tibial tuberosity. So the palpates. So this is the patella. This is a round patella in the middle. And palpate the popliteal area. So there's no swollen. Do you feel any pain?
No.
No tenderness, no pain, no warmth. Good. Also, there's a natural concavities underneath from the anterior aspects. Could you bend your knees? I'm going to check the muscle strength when you bend your knees. Push my hand. All right. And push my hand. When you extend, try to extend it. Okay. Good. Now straighten your leg and stretch it. And the other side. So now I'm going to check your feet and your ankles. This is the medial malleolus. This is the lateral malleolus. And this is the etius. So the contour of both feet, they are symmetrical. 5 toes on each foot. Could you just walk a little bit? Good. When you are walking, I can see there's a longitudinal arch on both of your feet. I'm going to palpate ankle joint to see. And do you have any tenderness?
No.
This side?
No.
Good. Range of movement about your foot. Could you point your foot towards the ceiling? Good. And try to push my hand. All right. And point your foot towards the floor. Try to push my hand. Good. Now bend the foot at the ankle. Then turn the sole of the foot toward and then away from the other foot. Okay. Now I'm going to stabilize your legs, then rotate your ankles. Now please bend and straighten your toes. Okay, good. Now I'm going to check your neurology system. So please close your eyes and occlude one of your nares. Take a deep breath. And tell me what the smell is.
I think it is orange.
Good, that's correct. So we'll check the other one. Take deep breath.
I think it's coffee.
Yeah,
Okay.
that's correct. Good. Check the optic nerve, the number 2. So this is a Snellen chart. And also do the confrontation test because the time is so limited. So it's already checked in the previous video, so we don't check it again. And next I'm going to check the cranial nerve, the 3, 4, and 6. So look at my finger and follow my finger. Okay. 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 Good. Good. The pupil responds to light. Okay, so responsive to the light. And also the accommodation already checked in previous video. I don't check it again. The trigeminal nerve number 5. I'm going to observe the face for any muscle atrophy, fasciculation, deviation. No. Check the muscle tone. Could you clench your teeth? So it's a bilateral symmetrical. There's no fasciculation. Good. So the next I'm going to check the sensation. The sharp, dull, and the light. Please close your eyes.
Sharp. Sharp. Dull.
And tell me when you feel I touch you, okay?
Okay. Yes. Yes. Yes.
Could you please open your mouth? Tell me when you feel I touch you.
Yeah.
Okay, good. Here's the cranial nerve number 7. Could you please raise your eyebrows? Good. Squeeze your eyes shut. Good. And wrinkle your forehead. Good. Frown. And smile. And show the teeth. Purse the lips to whistle. And puff out the cheeks. I'm going to observe the cheeks on your face expression, on your movement. Good. I'm not going to check your taste. There are 4 solutions on the table, and I will put like one drop of the solution on your tongue, let me know what the test is.
Sweet one.
Good. Yeah, that's correct. That's a sweet one. So for the cranial nerve 8, acoustic cranial nerve, it's already been checked before in terms of whisper test, the Weber test, and the Renner test. So I will not check it again for the time reason. Cranial nerve 9, it's a glossopharyngeal nerve. There's a gap reflex. I have to do it. Open your mouth. Could you take a swallow for me? Good. You say ah. Number 11, the spinal accessory. So let me check the muscle trapezius and the sternocleidomastoid muscle. Could you just push my hand, please? On this side. Push my hand, please. So I'm going to check the 12, hypoglossal. So could you open your mouth, protrude from your mouth, protrude out, and move your tongue in and out of your mouth, from side to side, a curve upward. You want to try to touch the nose, curve downward. Could you use your tongue to push my finger? And this side, good. There's no tongue fasciculation, cerebellum function, the proprioception. Like this, use your hand to pat your knees, and also like you can use the palm up and palm down to do it. Sometimes palm down, palm up. Finger to nose test. So touch my finger and point to your nose. Touch my finger on your nose. I'm going to test the ear to chin. So go straight forward. Good. Okay, do the balance test. Could you close your eyes? Are you feeling you are going to fall?
No.
Okay. Take a look at your gait when you are walking. Okay. Could you stand up, walking slowly, step by step? I can see the gait is smooth and the regular rhythm is symmetrical, stride length. Next is the sensory function. I'm going to test your primary sensory response to superficial touch of pen. I'm going to use a cotton wisp. Please close your eyes. Tell me when I touch you.
Okay. Yeah. Yeah.
Test your pen sensation. If you feel pain, let me know. Okay.
Yes. Yeah.
Sensation of the vibration. Tell me if you can feel the vibration.
Oh yeah.
Your perception of the position sense. Could you reach out your arms? So I'm close your eyes. I'm going to move your fingers. Then tell me it's up and down.
Up.
Okay.
Down.
Good. Your ability to identify some familiar objects. Please close your eyes. I'm going to put something in your hand and tell me what it is.
A coin.
The next, I'm going to assess 2 points discrimination. Tell me how many points you can feel. Please close your eyes.
2.
Assess your ability to identify letter or number drawn on your palm.
8.
Good. Assess your ability to identify the body area when I touch you.
Leg. Foot.
Okay, good. So the superficial and the deep tendon reflexes. The first one is abdomen reflexes. Good. Good. I can see the slight movement of the umbilicus. I'm going to check your deep tendon reflexes. The first is the biceps. Okay. The other one. The bronchioradialis. Okay. And the triceps. And the patellar reflex. And the Achilles. And the test for ankle clonus. There's no articulation movement. Good. Thank you so much.